I wanted to take this opportunity to say a few words about health care in general and about the needs of our children in particular. And let me preface my remarks by saying that I think it is clear to most Americans that our health care system today is disintegrating and that we unfortunately and tragically remain the only country in the industrialized world that does not guarantee health care to all of its people as a right of citizenship. Now, I hear a whole lot of talk here in the Senate, and I heard it in the House, about health care, but up front, we should be aware that there is something fundamentally wrong in terms of the way we do business, that 46 million Americans have zero health insurance, that the cost of health care is soaring every single year, and that tens of millions of Americans who do have health insurance have very weak insurance programs and are underinsured. And on top of all of that, with 46 million uninsured, tens of millions underinsured, we continue to pay by far the highest prices in the world for our prescription drugs. In other words, Madam Chair, we've got a problem. And the time is long overdue for the Senate to stand up to the insurance companies and the drug companies and start representing the American people. And in my view, what the solution is moving us toward a national health care program which provides health care to every man, woman, and child as a right of citizenship. And when people say, well, something like that will be very expensive, well, not really. What we have now is clearly the most inefficient and wasteful non-system in the world, by which we are spending twice as much per capita for health care as any other major country. So people say, well, gee, the Canadian system isn't perfect, the British system isn't perfect, the Danish system isn't perfect. True enough. Neither is our system, and we spend twice as much per person on health care as do any other system. Madam President, tonight and in the coming few days, we are going to be focusing on the needs of our children. And what we have in the midst of a nation with 46 million uninsured, we have over 9 million children, 1 in 9, who are also uninsured. Every 46 seconds, another baby is born uninsured in the United States. I have heard a lot through my career in the U.S. Congress about family values. So let me be very clear and suggest that it is not a family value to live in a country in which 9 million children have no health insurance at all. Uninsured children are almost 12 times as likely as insured children to have an untreated medical need and are 4 times as likely as insured children to have an unmet dental need. The statistics go on. An estimated 2/3 of children and adolescents with mental health needs are not getting the care they need, and only 1 in 5 children with serious emotional disturbances receive specialized treatment. Given this sorry state of affairs, I find it ironic that we are having any debate about increasing health care coverage for children under the CHIP program. Madam President, it seems to me that the very least this nation should be doing is providing health insurance to every child in America, something, by the way, that this bill does not do. If this bill in its current form were to pass tomorrow, it would provide health insurance to approximately 1/3 of the children who are uninsured. 1/3. In my opinion, as we move toward a national health care program guaranteeing health care to every man, woman, and child, at the very least we should be doing is making sure all of our children are covered. And that is why I have recently introduced S1564, the All Healthy Children Act of 2007. And this bill, in fact, would provide the opportunity for every child in America to have health care coverage. In addition, since insurance coverage alone does not guarantee access, in other words, you can have health insurance, but you don't necessarily find a doctor or a dentist who will treat you, we must also make certain that there is an adequate supply of health professionals and conveniently located sites of care. Along with Senator Murkowski, I have also introduced S941, the Community Health Centers Investment Act, to significantly expand the number of community-based, federally qualified centers, a proven cost-effective system of primary health care that is governed by the people who use them. These health care democracies serve all, regardless of ability to pay and insurance status. So the issues that we are dealing with in terms of health care is not only providing health insurance, but making sure that there are doctors and clinics and hospitals available to treat the people who need the help. One of the crises, of many crises, that we are facing as a nation in terms of health care is, believe it or not, we are not producing the doctors that we need for today, especially in rural areas throughout America and primarily in primary health care. We are not producing the dentists that we need. We're not producing the nurses that we need today. And as our nation becomes older, those problems will only become more severe. In that regard, I have done what I could and will continue to move forward to significantly increase the funding for the National Health Service Corps, to provide scholarships and loan repayment to those choosing primary care specialties and agreeing to practice in underserved areas. I am happy that we are on a path to increase funding for community health centers, but clearly we have got a long way to go in order to fund the National Health Service. Madam President, while the debate on these initiatives await another day, I believe that we must pass a CHIP bill that matches the House bill in funding level. Accordingly, I will be co-sponsoring Senator Kerry's amendment to provide SCHIP with a $50 billion increased authorization over the next 5 years. At a minimum, though, I certainly hope that the Senate passes the bill approved by the Senate Finance Committee. Madam President, I know that some of the objections that are raised about expanding health care coverage for our children come from people who think that spending the kinds of money that is being proposed in this legislation is just too much. I would mention to those members who, in many cases, and certainly including the President of the United States, are supporting the repeal of the inheritance tax, the estate tax, to tell them that with the full repeal of the estate tax, one family, one of the wealthiest families in America, would receive in tax breaks almost as much money as we are attempting to spend right now to increase and provide health care for over 3 million American children. So on one hand, there are people, the President of the United States, among others, who say, we've got to repeal the inheritance tax, all of whose benefits now will go to the wealthiest 0.3%, one family getting $32 billion. That's a good idea. But to provide $35 billion to provide health care for over 3 million American children, that's a bad idea. Well, I think that those priorities are a little bit backwards. Madam President, let me just conclude by saying that all of us are very proud to be Americans, and we want this country to be number one in many respects. And it should not give any of us pride to know that in every other major country on earth, virtually all of the people have health insurance as a right, have lower cost prescription drugs than we do. And the idea that today and tomorrow we will be debating whether we can afford to provide another 3 million children with health insurance suggests to me that we've got a long, long way to go in this debate. We should not only provide health insurance to 3 million children, we should provide health insurance to the over 9 million children who are without health insurance. And we should provide health insurance not just to 9 million uninsured children, but to 46 million uninsured Americans. In my view, health care is a right, not a privilege, and the idea that there are people today who are scared to death about what happens when they or their kids become ill because of the high cost of health insurance is something that should not take place in this country. So, Madam President, this bill is a small but important step forward. At the end of the day, we have got to join the rest of the industrialized world and make sure that all of our people, regardless of income, have high-quality health care. Thank you, Madam President, and I would yield back the balance of my time.
Senator from Vermont is recognized.
I ask unanimous consent. President, I ask unanimous consent that there now be a period of morning business, with senators permitted to speak therein for up to 10 minutes each.
Without objection, so ordered.
Madam President, I ask unanimous consent that the Senate proceed to the immediate consideration of S. Resolution 284, submitted earlier today.
The clerk will report.
S.Res. 284 to authorize testimony and legal representation in City and County of Denver versus Susan I. Gomez, Daniel R. Egger, and Carter Merrill.
Without objection, the Senate will proceed.
Madam President, I ask unanimous consent that the resolution be agreed to, the preamble agreed to, the motions to reconsider be laid upon the table, and that any statements relating thereto appear at the appropriate place in the record as if read.
Without objection, so ordered.
Madam President, I ask unanimous consent that the Senate proceed to the immediate consideration of H. Con. Res. 175, just received from the House and at the desk.